Welcome to Medical Myths, Legends, and Fairy Tales. I'm your host, Dr. Alan Christensen. Look, you know that between the latest online fads and the crazy media headlines, it's easier than ever to get confused about your health. And you and I just want to feel better and live longer. We want to know what works. And we can't wait for further studies. We need to make decisions today based on the best evidence we've got. Well, that's exactly what this show is here for. So let's get to it. It's odd, but it seems that protein is among the most controversial points in the diet, and it's one of the most essential elements. I had a second interview with Dr. Gabrielle Lyon. She's a physician and a gerontologist. She's done training on muscle-centric medicine, the relevance of protein in human health and aging, and been involved with some large publications on these topics. So I had her on. The occasion was that she was recently a guest on a large national media television show, and the topic was about red meat. There were several that had the side that red meat was dangerous at any amount, and she was citing more of the scientific evidence about that, and didn't feel like she had a good chance to really talk through the data. It became more a heated emotional discussion. So I brought her on, we're friends, and said, let's just talk through it and tell me the data that you didn't get to share properly, and I'll let people know about that. We talked about the latest study. There was a large meta-analysis calling into question the dangers of red meat. I also talked a bit about the environmental impacts of food choices. So had a good talk, and hope you enjoyed this time with Dr. Gabrielle Lyon. Hey, here I am with my friend, Dr. Gabrielle Lyon. Gabrielle, how you doing
I'm
today?
doing great. Thank you.
Good. Yeah, so I told the listeners that you were, practically jumped, put in as a shill, as a straw man to be spoken against. But the topic of protein is so emotional. And that's why I was excited to help let you really express the science you didn't get a chance to do. And let's talk through this. There was the big new meta-analysis calling into question whatever concerns we did have about animal protein, specifically red meat and processed meat. So let's talk through the science and what we know today.
Well, first of all, thank you so much for having me on to have the opportunity to speak about this, because first of all, what we hear in the media is largely biased. And if this topic, like you said, is so emotional, if we were talking about turnips, nobody would care, right? It would be, this is the data, and according to this data, we should eat more or less turnips. However, meat, as it is, has a face, and nothing is more controversial or really considered the black sheep of the macronutrient family other than, in particular, red meat. And so the annals came out with these groups of studies. So they were 4 parallel systematic reviews, and it included observational data, randomized control trials. So it contained top-level evidence and low-level evidence. And overall, it looked at about 6 million people. And these researchers, who, by the way, do this for a living, and they look at the data and determine, is this data relevant? Where does it fit in with the recommendations that we give out to the public? So they didn't have an agenda either way. They were not pro-protein, against protein, pro-vegetarian, against vegetarian.
Super brief, just to jump in for a second. I actually saw they even disclosed their own dietary preferences. I read the paper and I saw that. And yeah, there was a pescatarian in the board, and there was a full mixture.
And that's a great point. It was they went to great lengths to really dive deep into what we've heard for the last 30 years, that red meat is bad. And what they found, to everybody's surprise, well, probably not ours, but to this world that is pushing plant-based, that once they did the analysis of the data, they found that no one needs to reduce the amount of red meat or even processed meat that they're eating. And by the way, the amount of red meat that the average American consumes is about 2 ounces. So, we're not talking
per day.
Correct. It's not actually a lot. So we have this global recommendation that was put into play many, many years ago to reduce the amount of red meat, that red meat causes cancer, heart disease, stroke, this whole plethora of illnesses and chronic diseases. Lo and behold, we found that, it didn't. And that is super profound.
The paper talked a fair amount about one distinction is just about the relative risk and absolute risk that was involved. Do you want to talk about that a bit more? Or?
Sure, certainly. So when we talk about relative risk, that is, for example, the risk of doing X increases your risk of getting Y. So if you smoke, you have an increased risk of getting cancer. And to take a step back, the numbers that are considered valuable, so if it is significant, would be anything above 2. So if you smoke, your relative risk of getting cancer is 12. That is a large number, again, because it's above 2. Now, if you eat protein, red meat, your relative risk of any of these diseases that had been claimed in the past is 1.2. So what that says is there is no relative risk. There is no risk. And what we've done is that they have made, these governing bodies have made massive public health recommendations based on very weak evidence. And I think that Dr. C, you and I, we're not epidemiologists, and we can leave it up to the scientists to argue the methods that they used, which have been validated and used by 100 other countries. By the way, this grade system, which is how they actually utilized the data, it's the same system that determined that trans fats were bad for us. That they can kind of argue how that is done. What is so important about this group of studies is that it really makes us question, can we make massive health recommendations, like reducing red meat, based on very weak evidence? And I say that we can't. I mean, red meat is a very healthy food. It's, the OGs of superfood.
And something that seems like a reflex almost is to look at a trend. And our trend in terms of obesity and our trend in terms of metabolic diseases is not a positive one. These things are worsening. Well, I guess it's positive in a scientific sense. It's, but it's not something we want. It's a negative emotional thing. We're seeing more of that. And it seems like very intuitive to say, well, if Americans do X and this bad thing is happening, then that must be Y. And I've seen similar arguments about many facets of the American diet. And the pitfall is that one part of it may not be relevant. It may not even be as big of a factor as is thought to be, or it could have just the exact opposite effects.
Absolutely. And, taking that into consideration, particularly red meat, which is really what the study was about, is that consumption has been down by 30% over the last few decades. It's down over 30% in the last few decades. Red meat consumption is down, but statin use, because people say, well, red meat is bad for cholesterol. Statin use, there's 35 million people on statins. And yet we continue to reduce our red meat consumption and overall protein consumption. It just doesn't add up.
Well, and I've seen trend numbers about just obesity crisis and its rate the last several years. And yeah, there has also been a decrease in total carbohydrate intake, but the obesity crisis is still rising. So people are doing less red meat, and these negative situations have not been improving.
I think that when you tell the mass public to reduce a healthy food like red meat, and I think it's really important that the listeners understand it's a very healthy food source. It has high levels of B12, which you need for pregnancy, right? So I have a newborn 10 weeks old. You can't get that B12 from plants. It's not, you can supplement, but we're talking about whole foods. How can you get the most nutrition from the foods that you eat? And B12, zinc, iron, heme iron, all of these nutrients are so valuable. And if you say, okay, I want you to further reduce your red meat consumption, what are you going to do? You're going to increase your carbohydrates. I mean, we're already arguably a plant-based diet. 70% of our calories comes from plants already. So by saying we should be plant-based, what does that mean? Where is that defined? The average American has a broccoli quota, I swear, right? I've seen this in my practice. If you tell them to reduce protein and increase their vegetables, there's only so much broccoli an individual is willing to eat.
Well, and the whole message too about just food groups and food categories being bad and being vilified. I think that there's often emotional consequences to that, and it's often more effective to talk about the things to focus on and things to include.
I think that that's absolutely spot on. And going back to the science, right? So I was in this debate with a scientist who is very loud in the vegetarian vegan group. And he said to me, which shocked me, we don't need randomized control trials to tell us that running with scissors is bad for our children. And this is what he said. And he correlated that to, we don't need information to say red meat is bad for us. When that's just shocking to me, because the DASH diet is a randomized control trial. The Mediterranean diet, the Predimed, is a randomized control trial. And those have all been validated to be 20% protein, and that protein can come from red meat. So the follow-up studies regarding that can come from, all of your protein intake could come from red meat in both of those trials. So when I was on the show, it was so frustrating because he was utilizing emotion, saying we don't need randomized controlled trials, but we do, and we have them. The only issue is that we don't have them supporting a vegan lifestyle or largely vegetarian lifestyle. We don't have randomized controlled trials that support that, but we have 30 years of data, and that's just two very well-known studies, the DASH diet and the Mediterranean diet, the Predimed diet, that are being utilized by physicians. So we do need randomized controlled trials. They are available. To play off emotion is not the right thing, saying somehow eating meat is equivalent to running with scissors, or, he correlated to we don't need a randomized controlled trial to show that the carbon monoxide is bad. It was this vein of like emotional terrorism. It was taking the science out of it, putting emotion, and then really persuading listeners that the opinion is correct when the science says otherwise. It's very frustrating.
Well, I mean, carbon monoxide and running with scissors are rather straightforward. So it's basically an argument by tautology. You're assuming something's already true and saying you don't need to prove it. But we're not sure what's true or not. We want to figure out what's best. And the data evolves over time. We want to stay on top of that.
I couldn't agree with you more. We've been eating red meat for 2.5 billion years. That's the reality of it. To have this kind of propaganda against it is very dangerous for society. And one of the other topics that's brought up a lot is agriculture, and that beef and cattle are destroying the environment. I'd love for you to weigh in on that, because I certainly will.
Yeah, so you just mentioned about how we've been eating meat for a couple billion years. And overall, there are a lot of arguments back and forth about plant-based diets. And I would say that the arguments for including plant foods of good types and good quantities in lots of categories, there's very strong arguments. But I've just never really found strong, solid evidence arguments against the inclusion of animal foods as well. So when people hear about we've eaten meat for quite some time, the reflex comment I often hear is that, yes, but things were different in the past. So what are your thoughts on that?
I think that things are different. And actually, what we need to do, because we're largely domesticated, we're moving less, we're exercising less. You have, muscle is your metabolic currency. So yes, things are different. We were hunters and gatherers. We were very active. And as times have changed, we've become largely less active. And issues with muscle like sarcopenia, sarcopenic obesity, these are all illnesses of the tissue, start in midlife versus late life, like we would anticipate. Getting to the point is that actually, to protect your metabolism, you need more protein, high quality animal proteins, as you age and in midlife than ever before. So back in the day, when we were much more active and we didn't have, those like electric scooters and all of these other electric type things, we were utilizing our bodies more. So my argument to that would be we actually need more.
Mm. And in terms of foods changing, I would add on to that, no food is the same as it was some time back. Even a carrot or broccoli you're mentioning earlier, to have that from a few thousand years ago, those things were barely edible. They were quite distinct, and we had change across the board in all food supplies. But this is what we have. We've got to do our best to make use of it. The other question that comes up is about cancer risk. So the data has evolved on that as well. In the past, I talked about there being some contribution that red meat has towards the relative and absolute risks for colorectal. that was known to be small, but now that's seen differently as well. So just give us the big picture about cancer of various types and what we think about our risks relative to red meat.
The big picture for cancer is interesting. Actually, lung cancer kills more people than breast, colon, and prostate combined.
Wow.
So we've got, breast, colon, melanoma, ovarian cancer. These cancers, especially breast cancer, is much more prevalent. But smoking, our ability to save people, is largely unchanged, and that's really the big cancer risk. So as that relates to protein, we know that there's no relationship. And in fact, there's no relationship. There's never been a proven relationship between protein and any kind of cancer. It's just never been proven. So I love what you said before, how you said that the argument is strong, but really the evidence is weak. And cancer is a disease of the genome. And that's something very important to differentiate.
We'll be right back after a word from Integrative Health.
We hope you're enjoying this episode of Medical Myths, Legends, and Fairy Tales. This is Dr. Raquel Espinal at Integrative Healthcare. So often we hear from our new patients that their primary care physician has told them that their thyroid and hormone levels are fine and they should not worry. Yet the patients still have symptoms of severe fatigue, thinning hair, and weight issues. Unfortunately, this is too common with thyroid care. The good news is we can help and there is hope. The doctors at Integrative Health, including myself, specialize in naturally treating your thyroid, your hormone, and adrenal issues. We would love to get you started on the path to ideal health. From the comfort of your own home, you can get treatment with one of the doctors at Integrative Health via telemedicine. Go to integrativehealthcare.com to become a new patient today. Use the code PODCAST20 for 20% off your new patient visit. Again, that is integrativehealthcare.com and use the code PODCAST20, all one word. Get back to the road to thriving. We look forward to seeing you.
And now, back for more medical myths, legends, and fairy tales. The other big direction, and I guess this came up with the recent debate that you were in, was about just the environmental effects. And I've not been exposed to this data as much either way. I've heard some from both sides of that, but what are your thoughts? What's our best data telling us about just the environmental impact of our dietary choices on if we're consuming meat or not?
This is probably one of the biggest myths in the media. The media would like us to think that cattle in the U.S. creates greenhouse gas, and that's what is largely responsible for the greenhouse gas issue. I hate to break it to everybody, but actually all of agricultural is around 9%. Of that 9%, about 3.5% of the greenhouse gas is related to cattle. So 3.5%. Of that 3.5%, that is also dairy cattle. Really, if we were to eliminate all cattle, our biggest chances of change would be around 3%.
Wow.
80% of greenhouse gas is from transportation, industry, and electrical use. And this comes from the EPA. This is not my opinion. This is what the data is out there. That's what it is, right? It's not that I'm having an opinion about it. I'm just simply citing the information.
I had just done some browsing myself and come across pretty much the same numbers from some good objective sources. And I've heard people very passionately say things that it doesn't really matter what you drive if you're having meat, and just these strong statements as if that were the biggest needle mover. And yeah, I'm just not seeing that information.
And it's interesting. I think the bigger question is why? Why are we making red meat, beef, cattle the fall guy? It's very confusing. It's emotional, and it really does a disservice.
Are there certain groups or certain biases? Or
I will say that nothing makes me feel more responsible for not just my daughter, but for other people than realizing that we're all they have. So if we know something to be true and we don't share it, that's egregious. It's our duty to have the knowledge and to share it. It's our duty.
And that's often hard. I don't know. I've thought about this in my profession and in our whole. You're in the same space with me, this health expert space, and it's almost like we had all these big revolutions that occurred by extensions of our senses and microscopes, telescopes, or whatnot. And I think now the biggest extension has to be how we utilize our own thought process and being able to get past our immediate apprehensions and biases and being able to be more objective and not make the quick leaps and then just stay attached to a certain viewpoint. I think that's like the revolution that we were in need of, but it's really a lot of just the way our minds are hardwired that we have to correct for. It's difficult.
And I think another thing that's really difficult, or I've been thinking about this a lot lately, is a lot of individuals in our space, Dr. C, are plant-based. And I have the potential to be ostracized because I don't know what plant-based means. I think we're already doing a plant-based diet. We tried a plant-based diet when it came to the food guide pyramid. It doesn't work. I've trained in protein metabolism from a world-leading expert, and I've trained 7 other years in nutritional sciences. My opinion is really irrelevant, but the science that I have read and bring forth is relevant. And it really goes against a lot of the opinion and emotion in the space. So I have to say, I feel really grateful that you're willing to talk with me on this. And, you and I see very much eye to eye on this matter.
Yeah. Well, the data is so strong about just our effects as we're aging and our general health effects of blood sugar, metabolism. It's really straightforward thing. And yeah, people often do easily get into camps about being a hardcore paleo, hardcore vegan. And yeah, I don't fit into any of those camps, but I really see this benefit. It was a big part of my own personal health story. And over the years of patient care, I've had just countless times in which someone would have major symptoms and suspect it were their thyroid or some hormonal problem. And I would investigate that with them. But along the way, just look at their diets and say, hey, what if you were getting about a quarter, a third of your calories from protein? Let's just try that out for a few weeks and see how that affects you. And just countless times to where someone would be chronically fatigued or other major symptoms, and they would reverse just from that step alone. There's so many examples of that.
Yeah. And there's just so much hype out there and misinformation. For example, most of the fat in red meat is saturated. That's actually not true. The fat in red meat, 51% of that is essentially olive oil. It's oleic acid. And I'm just going to let that land for people that 51% of the fat in red meat is monounsaturated. It's the same fat in olive oil, the same fat in avocado. But individuals are saying, oh, red meat is this dangerous source of saturated fat. And frankly, I don't buy the saturated fat argument. The majority of the fat in our human body, in our human body is saturated fat. It's palmitate. So if it were so bad for us, then why are we not all dead? I mean, it's what we're made of. So there's just a lot of myths out there that are catching on like wildfire.
Something I'd love to chat with you about at some point in time. I won't get into it now, but I've got a piece that I've written recently on linoleic acid. And that's surprised me to look at a lot of the core research on the outcomes of tissue levels or dietary intake. So I think in a lot of times, many things like red meat or linoleic acid can become a proxy for just a processed food diet. People have diets that are high in processed foods. Their lives have been overly processed. They've been lacking in connection. They've been lacking in mobility, lacking in a sense of just real contribution. And these things have clear health outcome effects, but a lot of elements of it, like for example, omega-6 linoleic acid, it's been a proxy for highly processed diet over the last few decades, with a lot of highly processed foods having high amounts of corn or soy oil. And it's been easy to say, oh, the omega-6 must be the culprit. But if you look at it by itself, that data doesn't really pan out. But nonetheless, there's this whole constellation of patterns that go together that produce a negative outcome. And it's easy to say one part of it is to blame when that part in isolation may have very different effects. And the whole hormonal effect of the inflammatory effect of the eicosanoids and the fatty acids you were talking about the red meat, the saturated fat. So arachidonic acid, omega-6 fats. What we're learning now about inflammation is that it's not so much just that you plug in one molecule and you get an outcome. The term is pleiotropic. These molecules are used in a variety of ways, and all of them, all the main active essential fats are really just linoleic and linolenic. And of those, we make a big variety of prostaglandins, some of which are pro-inflammatory and some of which are anti-inflammatory. And the body is choosing that as it sees fit. And chronic health conditions can correlate with the predominance of inflammatory chemicals, but not because just sheer matters of ingestion, more matter of how the body utilizes those things. So yeah, it's been really fascinating.
And that's a great point. I mean, that's what we found for cholesterol.
Mm-hmm.
The body, that the dietary cholesterol is not the issue, that the body has a set point amount of cholesterol that it makes. And it's really how your body processes it, not what you're ingesting, but, exactly to your point.
And also, just you mentioned about the types of fats. We have to think about fats as being a thing, like olive oil is this kind, and beef is this kind, and really all foods that have substantial amounts of fats, they all have a big variety. I mean, they have a predominance, but none of them is just one type or just the other.
Absolutely. And the biggest issue that I see from, in my clinic is excess calories.
Yeah.
So you do have to get the macronutrients correct. But, number one, I would say you must get your protein correct. And then after that, the excess calorie issue, for example, if you were to go largely, quote, plant-based, that is a large caloric load. And that destroys metabolism because, number one, it destroys muscle because animal protein and plant protein are different. I was on the show where they argued that you don't need animal protein, that you can get all the protein you need from plants. That is not substantiated at all. There are decades of research that show the difference of the muscle tissue between the amino acid profile in animals versus the amino acid profile in plants. Not to mention, plants are notoriously low in methionine, and grains are low in lysine. These are all essential amino acids that are not just for the building blocks of protein, but also potent stimulators. So they are metabolic stimulators of chemical reactions in the body, that if you really reduce your protein, that there are really devastating consequences on the muscle tissue, that quality of protein.
And I would just question the definition of need in that case. That's one thing I always drive into, is that what do you mean by need? I mean, if by need you mean fall over dead tomorrow without it, correct. There's as omnivores, there's almost nothing we need by that definition. We're pretty flexible. But if you're talking about really optimizing your health span and minimizing your chronic disease risk, that's a different type of need.
Right. And this is really about the optimization of individuals so that they can change the trajectory of their aging. These are all really important topics that are on my mind and I think really need to be addressed. And one of those, the really big topic is, are we eating too much protein? And we're not. I mean, the average American eats around 70 grams of protein. That's that's enough to just maintain whatever health status you're at.
Well, and not enough to offset the sarcopenia that's such a common part of age.
Or to increase metabolism, to increase muscle mass, to improve fatty acid oxidation. So essentially the thermo effect of feeding, the thermo effect of protein. There are all these benefits from increasing protein without the downside. I mean, I would say the biggest downside of increasing your protein intake is not the impact on the environment, not your risk of cancer, but it's more expensive. Simply an expense. On the flip side is, if we remove the protein from the diet, what are we putting in place? Because people are going to eat their calories regardless.
What are your thoughts about some mixture of plant and animal proteins, how they combine out, and relative merits of that?
It's possible. I mean, it's possible. I think that we, in the short term, supplementing with a pea, hemp, or rice blend, making sure that those amino acids are adequate, using adjunct amino acids, can work for the short term. I recommend it for the short term, but over the long term, we don't actually know what those isolates do to the body. We don't know any long-term effects of how that looks over the long term.
And what are your best thoughts now in terms of someone knowing their optimal amount? Is that as a percentage of intake or grams per body weight? Or what's the best way to guide someone on that?
Yeah. So it's interesting. So the percent, so like the DRI would recommend in percent, and it's protein is never about a percentage. It's really about a body weight. Because if you have a low calorie diet, if you're looking at protein percent, it wouldn't be that, right? And we know for a fact that you need around 30 grams of protein to activate the metabolic machinery to protect your muscle. So that would be around 4 to 5 ounces of protein per meal to actually have a muscle effect, a protective effect when it comes to that tissue. I personally recommend in my clinic about a gram per pound body weight, depending on how, what their baseline weight is. But on average, that's what I look at for a patient, yeah.
So I love the distinction about the percentage right there, because if someone is consuming a low amount of food intentionally to lose weight, they might be consuming, just make up a number,
Right.
like 1,200 calories per day, and their 30% of protein may end up being insignificant. It might only be 40
Right.
grams or so to hit that 30%. So when you're eating less, your protein needs don't stop.
Right. And it's really vital to protect your tissue. So the quality of weight loss matters. It's not about overall weight loss if an individual wants to lose weight. It's an overall fat mass. And as you go hypocaloric, your tissue then becomes metabolized. So if you are in a catabolic state, one of the things that the tissue looks to do is break down your muscle. And protecting that is essential. So protein is based on body weight. It is not based on percent calories at all. And that's really key. I mean, of course, this is my opinion. My recommendations are a bit higher, but the recommendations go from anywhere from the RDA, which is 0.8 grams per kilogram, which is too low. And all the position papers, like the ProDage paper, recommend, at least 1.2 grams per kilogram. But you could easily go up to 2 to 2.2 grams per kilogram, or 1 gram of protein per pound body weight, which is what I recommend, which is what I do, and is what I utilize in my clinic and in my family.
And listeners, if you've not done that much, this can be a great time for food tracking, just if nothing else for a period of time, to see what that really plays out like with your day-to-day life. If you've not taken a month and consumed about that much, it'd be a great thing to test and see how you do in terms of just the stability of your energy, your mental function, your enjoyment of exercise. Often people that really have to work hard and push themselves emotionally to exercise, they're often not nutritionally sufficient to do it well. When you are, you want to, you enjoy movement and you recover from it and you want more of it. Would you agree with that? Or
Absolutely. And there's no downside. So we don't have a downside. And that might be a lot for people to consume. And the reason it's probably a lot is because the paradigm of thinking has to change. We've never been told to eat more protein or to, unless you're really a bodybuilder, the concept of protein has not been a target of focus.
And it's curious to me just how strong the emotions are about it when there's not been the good data to support those views.
Right. And there are lots of randomized controlled trials and a ton of data that supports a higher protein diet. And I don't even like to use the term high protein. I like to use the word optimal.
You're talking before about just the relative effect of caloric load and total fuel intake being important. And I think in a lot of cases, the messages that go viral are messages that seem to be counterintuitive or stick it to the man or go against conventional wisdom. And so in a lot of ways, it's been popular to bash on calories. And for sure, not calorie counting is not the most successful way for everyone. There's a lot of ways it can be done badly. It's not always easy to predict someone's caloric needs, but nonetheless, in controlled situations, it really does matter. I don't know if you've seen this, but there's a person online. I've not seen him for a while. I can't remember his name, but he's done these stunts to where he will set a caloric target and then set a protein target and then consume some ridiculous food, but get his protein. And over the course of a few months, go from whatever shape he was in, which is often he still start out not very lean, but end up just phenomenally fit and ripped. Well, he's eating nothing but, X calories of ice cream plus however many grams of protein he needs from one particular source. Have you seen that before?
I haven't.
This guy has done this stunt a few times with different foods. One time, I forgot what they're always like to prove that point. He'll do some total junk food, but stop at the calorie target and then fall and then really hit what would be an optimal protein amount for his needs. And of course, exercise, but be in phenomenal physical health. And he's made statements saying that, yes, for sure, you're better off long term to have diversity in your diet and plant foods. But this is just showing how strong of a factor those couple of things are.
I think that that's phenomenal. I'd love to see it. And, I think that none of us are anti-plant. I'm certainly not anti-plant. I think that the conversation needs to switch. And it's not about eating more plants. It's really about eating better plants and optimizing your protein. There has to come a point where the paradigm of thinking shifts, because the definition of insanity is that we keep doing the same thing.
And just in general, all the times I hear about strong fears made about some type of a food, that's a food that, not talking about foods that came out in the last few decades, but foods that our grandparents or great grandparents could have eaten. Anything that demonizes a food that's we've had that much time to adapt to, I've never found the real evidence behind the arguments compelling. We need food. We're pretty well adapted to it. And for sure, we can get too much. And there's no doubt about the theories that processed food may hijack our appetite. But real natural foods, there's just not good data saying any of those things.
Absolutely. Absolutely. And, interestingly, there's this concept called the protein leverage hypothesis. Have you heard about that?
Oh, for sure. Yeah. Yeah. Please explain that to us.
And that's by Simpson. And I think it's Steve Simpson. I'm not entirely sure of his first name, but it is the concept that humans will eat and continue to consume calories until their protein needs are met. So if you are eating a low protein diet, you will be driven to continue to overeat carbohydrates, overconsume to try to get those amino acids. And that's a very important point. There's something to be said for having high quality protein to turn off that drive to feed. I mean, we're made of this stuff.
I've certainly had many patients give me feedback about that phenomena. I've experienced that myself. When I've been on attempted diets that were more restrictive, I'm never not hungry. And then during times of just ongoing cravings, I would have an egg or some pieces of chicken or something, and it was done. Then I was fine all of a sudden. But before then, I knew that it just wouldn't stop on any amount of food.
Yeah. And that's really important to know, because you and our goal is to make it better for the individual, to really leave the world a better place and to allow people to suffer less, because the information out there that we can provide would be of benefit. And the suffering that I've seen is totally unnecessary. There's enough challenges in life that come. It doesn't have to be ones that are placed on us from our information or poor behavior.
That's awesome. Any other points that you didn't feel you were able to get across in the recent media appearance, or other points you'd hope to cover here? Or?
I think the big one to wrap it all up is that we cannot be making large health recommendations based on weak observational data. So the information that we've said that red meat is bad and protein is bad is all based on very poor quality data that we would never make any recommendations on those things. And we haven't. So I think that that's really very important. And I think this study brings up, this collection of studies bring up this very important information that we really should question the information that is being put out there in the media, and that individuals have a very strong agenda for their point rather than what is of the benefit to humanity. So I think that that's my number one point, and that there is no evidence that red meat is bad, that we shouldn't reduce our consumption, and arguably people would benefit from eating more. Protein and cancer, those things do not exist. Red meat and cancer, there is not high relative risk. It may be a fiber issue, but there's no data to support that it's a red meat issue. I think that and then the environmental issue, those are really the big things.
That's awesome. And those who want to see more of your work, what's their best place to go to? And
The best place to find me is Instagram, and that's Dr. Gabrielle Lyon. And I have a website, which I will be relaunching soon. I don't know how soon. I do have a 10-week-old, so that more than I can manage. But that is in the works, and that's drgabriellelyon.com. And Facebook under the same name. And I have a great weekly newsletter that will be back on track once by the time this episode airs, and that they can sign up for free. And I really try to provide evidence and things that I'm reading, my thoughts, and also the science.
Oh, that's cool. Nice to get to connect, and fun little treat to hear your baby a little bit here today.
I really appreciate your willingness to share the science, Dr. C. If more people would be willing to do that, I think together we can all clear up a lot of the confusion.
Well, that's what we're trying to do our best for. So yeah, thanks for fighting the good fight too. Hey, Dr. Christensen here. Thanks so much for joining me for another episode. Is there a topic you'd like me to cover? I'd love to hear from you. Just go to Dr. Alan Christensen on Facebook or Instagram, write your question, and use the hashtag #MedicalMyths. Did you find this show helpful? If so, please take a minute and leave us a rating on iTunes so that others can know. Thanks much, and I'll be back with you real soon. Bye-bye.